Okay.
But when we're recording virtually, she's at her office at home, right? And so, and this is Tina.
Banging things.
I'm very emphatic. Yes,
Like Godzilla over there. I'm like, easy.
I have a lot to say, and I have feelings, and it's important to share them. That's what I've been told in therapy.
I tell you too.
Not
That's
done
not
enough
true.
therapy in my life, for sure.
Well, now you're in revenue cycle, so you're probably going to want to get that
Yeah, get a
lined up.
therapist fast.
It's crazy. Crazy world out there.
It'll uncover some stuff for sure. I've had to do my own therapy journey, as Tina knows. Yeah, no, it's good. That's what it is. Yes, but this one, you got to watch her. She's like hand talker.
Yeah.
Got it.
I'm Irish, though, not Italian. No Italian.
What
the
does that have
Irish
to do?
must do. It's very dramatic.
What Italians are known for hand things?
For hand talking. Well, for hand things, certain gestures, I'm sure.
That's something else altogether. We've derailed already. All right, our guest, Erin.
Hello.
Thank you for coming on the show.
Yeah, thanks for having me.
So, Erin and I met. I feel like old friends.
Yeah, kind of. I
Really?
would agree. I've been listening, and
She's been listening to the podcast.
yeah,
Can you
I
believe
feel like
that?
I've really gotten to know you
Wow.
because you told me about it.
I know,
and
but I
like-
say that to lots of people, and they're like, "Oh yeah, I got to listen to that." And I'm like,
Yeah.
nothing.
Well, a lot of my team knew about you. I guess you had an old name. The podcast was not
Yes,
Red
it was
Cycle Unscripted.
My good friends.
Yes. Yes.
But then nobody knew what that was, and there's
Yeah.
a story behind it.
Sure.
I might say that a fair amount.
Yes, we had to tell the story quite often.
So but then when we started 8 years ago, there were like no podcasts, right? So my good friends was like, it was fine. No one had it.
Yeah.
And then that we figured out you kind of need rev cycle or whatever
Yeah.
the niche is that you're doing.
Yeah.
It needs to be in the name or people never find it. So
What I love is sometimes you don't even really talk about Red Cycle, I've noticed.
yes,
Yeah.
Which is kind of cool.
a fair amount.
But we talk about the people.
Yeah,
of
the people in
RevCycle.
it.
Right,
Yes.
because I think that's what makes it
Yes.
interesting and human.
I totally agree.
And I think that's what people can relate to
Yes.
because we all have a story of how we got to where we are.
That's right.
And those stories are the things that bring us together.
Well, this
Nice.
isn't a thing where you go to school for.
I know.
So there's that aspect of
Don't
like,
get me started.
you
I
don't
wish
go to
there
school for
was.
this.
Yes.
And so then we typically start, and I think for you, like,
Yeah.
Erin and I talked a couple weeks ago when we met on the, and then we could have talked for a couple hours.
Yes.
We had like 30 minutes, and I
I
think
know.
we ended up for like an hour.
We just jumped right into to all of the
But I also was
things.
like, how did you end up here? And you're the only person I think I've ever heard in my whole life say, I chose
Yes.
RevPsych. I
Yes.
chose to like go into this. So you're
After
new.
a long journny.
Okay, so I think it's important in this case to like, we should hear your journey here.
Okay.
So
All
like,
right.
where'd you grow up? How'd you start?
Yeah.
What's
we
the
should
matter?
introduce Erin to the people who are listening
Oh,
with
okay.
us right now.
What?
This is Erin Hodson.
Oh,
Okay, yeah.
We did it.
Yeah. I mean, I'll tell you all the things. I'm pretty much an open book. So,
Okay.
first of all, welcome to my home, the DMV.
Oh, yes.
DC, Maryland,
Yes.
Virginia
You live
area.
here.
Yes, born and raised
Oh, you were
I thought she
born
was
and
in
raised
the
here?
Department of Motor
Born
Vehicles.
in the hospital one of the hospitals where I work, in Inova.
That's insane.
I was a
Okay.
Kaiser baby back in the day.
Oh, yeah, when they tried to get into DC. Okay.
Yeah.
Okay.
So there's a funny story there too.
I can only imagine.
So yeah, born and raised in Oakton and Reston, Virginia. Sorry.
touch the table.
Okay, all right.
Oh,
All right. I do it a
Wow,
lot
we
too.
gotta see
okay. Not the only one.
Yes,
Everybody, please take note.
All right,
So
keep
true.
going. Keep going.
Okay, so love this area. Love so much about it.
All right.
My family, my parents met in college here at George Mason University,
Oh,
so
yeah.
they
Yeah, of
lived here
course.
too.
Yeah.
And I have a lot of family here. So I was literally, and I live now about like 3 miles from where I grew up, but moved to Plano, Texas in 10th grade. My dad worked for Perot Systems, Ross Perot's company.
Are you
at the time.
kidding?
Yes.
EDS, right? It ended up being
It
EDS?
was a subsidy of, it was like EDS. I think they ended up merging.
My
or
uncle
something
was
later.
there. I
Really?
bet they knew each other. Yeah.
Oh,
That's
yeah.
so crazy.
He was like an AS 400 guy back in the
Yeah, he
day.
had to move to the same place.
Yeah, probably.
Yeah.
So that was like a culture shock, as you can
Yeah.
imagine. Here, this area, what I love about it, it's very diverse. The hustle bustle, you kind of get used to. Very well educated area.
Yeah, a lot of people in and out. So
Yes,
transient.
very
Yeah.
transient,
Yeah.
area, I would say, even where I live now.
Wait, do
there's
you have a
lot
big
to love.
family?
I have twin brothers that are both physicians now.
Twin brother, both physicians.
Yes,
Shut
they're
up.
about like 5 years younger than me. A
What?
urologist and an ED doc that actually works in the system where I work. And
Identical.
yes,
Shut your mouth.
yeah.
They went into the same field.
Well, kind of because of me. I mean, they might tell you different, but yeah.
Take
I
the
like
credit,
this.
big sister.
Yeah,
I
take
know.
the credit.
Full credit.
Take the credit.
So, okay, what I loved about Plano was the high schools were huge,
Yeah,
right?
enormous.
Yeah. And
It's
so,
like a college campus.
yes. And they had this specialty program where you could understand healthcare and rotate through the hospital. I got my EMT certification, my nurse's aide, and I loved it. Anatomy and physiology. And they saw me at the time. They were in middle school. And I think they got interested in that at the
so you were
time.
like doing some clinical work, and they
Yeah.
were like, "Oh, wow."
Yeah.
I bet that's probably similar to my story. My brother was a nuclear medicine technologist.
Oh,
He's 6 years older than I am, and I was
Uh-huh.
like, "Oh, that sounds awesome." I
Yeah.
had no idea what it was. It's not that
Sure.
glamorous, but it was like, "Oh, I should go into that."
totally.
Yeah, it turned
Totally.
out I wasn't going to be a doctor.
Yeah,
so
I
I changed
mean,
my mind in
same,
college, but
same.
yes.
Yes. When I went to college, I went to Rhodes College in Memphis, Tennessee.
Yeah.
Small, very
Yes.
different from the high school that I graduated, and ran cross country a little bit there. Had a lot of fun and started pre-med and ended up being a business major.
Oh.
So
I did that in graduate school.
yeah,
There you go.
and that was good. That was good. And
Nice.
then what journey? So then I went to Atlanta, out of college, worked at Arthur Anderson during the whole Enron scandal,
Oh, yeah.
2001 during 9/11. That was crazy. It was that was a tough time because I didn't have any family in Atlanta. I was working right out of college, doing a pretty like hardcore job at the time.
Traveling and then not traveling.
Yes. Traveling and then not traveling and then traveling again. And,
Yeah.
I didn't really love what I was doing. I was doing like benefits consulting with, I know. But I met some super
Yeah,
talented
yeah,
people.
Of course.
Yeah. And that was awesome. Then I ended up like kind of leaving that, did a couple things. It's funny when you're not, I feel like this today too, when you're not passionate about what you're doing, you just suck at it. You're not really good and
Yeah.
you're not engaged. And I felt that at the time. So actually met my husband, who was an entrepreneur at the time, and had the opportunity once we got married to go back to school, and I went to nursing school. So I got an accelerated nursing degree at Kennesaw State. Best value for money, $6,000 at the time to do that.
$6
Wow.
grand.
Yes.
That's
Yeah.
amazing.
You couldn't step
Yeah.
in a building for 6
know.
grand.
I know. Incredible.
You couldn't get accepted for
Yeah.
6 grand.
Seriously,
Yeah.
that's been more
Yeah.
than good.
Great program. From there, I got a job. Actually, while I was in nursing school, I had to work too because he was working all the time. And I got a job at the Shepherd Center, which was, it was an acute rehab specializing for spinal cord and traumatic brain injury patients. Very well known in the country, always makes U.S. News, World Report, best acute rehabs. They take vent patients, they do everything. And they actually, I think their statistic, I just looked at it, 91% of the time they can get patients home. They can get a quadriplegic 15-year-old kid home to his mobile home in Alabama and make it work for the family. And I just was passionate about it. I actually went there because I wanted to learn nursing skills and, learn how to work the ventilator and such. And they would let you do that as a clin tech at the time.
Yeah.
So
I worked, fun fact, you probably never heard this, Tina. In college and graduate school, I worked with TBA, home, like group homes.
okay.
So like I had both Michigan and in Virginia.
So you were, okay, talk to me about that more.
Well, because it was like you were there helping, like getting everyone fed and
Yes,
like kind of like
okay, got
being
it,
with
got it,
them
got it,
and like
yes.
making sure they took their meds.
Yeah.
And like it was
It's
that was hard.
important.
It was very
Yes.
hard work.
Yes.
It was very like there was some great relationships with some of those people,
yeah.
but it was very sad. Like 95% of those had some kind of alcohol related injury that they're there, right?
Yeah.
And then one guy in particular was like, he had been drinking, got in a fight with 4 other guys. They beat him almost to death. And he was like he was our worst one. Like he couldn't communicate, and like,
Yeah.
that was like hard. It was hard. I mean, it was like not easy. I don't think people fully understand like how much people can change and
Oh my God.
like their personality changes. Or they
Yes.
can't go home with the wife,
Yes.
even though they don't understand why they can't be home. Like
That,
that was hard.
I mean, I totally, the hardest part for me in doing that role was, and I was a bedside nurse when I graduated from nursing school there. I mean, really got to know people and their families. I mean, and you did a lot of nurse education I was a nurse educator there as well after I was a bedside nurse. And I taught a lot of moms and wives typically how to take care. There's a lot of spinal cord injury patients are males, just
Because
statistically.
we're doing stupid
I'm
shit.
like,
or
yeah, color
Yeah.
you shocked
I
by
mean,
this
motorcycle
information.
ATVs. I'll never let I have teenage boys. They will not get on an ATV. My one son is huge into football. I have to be at every event because I'm freaked out about that. But you spend like 3 months with
Yeah.
these patients. I still keep up with a lot of my patients via Facebook.
Wow.
So yeah, it was a great time in my life. We had a baby though, and I wanted to move home to Northern Virginia. And they actually said to me, well, why don't you be our Mid-Atlantic admissions liaison? And when there's an injury, you can go to the Level 1 Trauma Center and talk about, because you've now been a nurse educator with us and a bedside nurse, about what it would be like to come to the Shepherd Center, because they have a lot of patients that even come internationally and all over the U.S.
Right.
So I did that. And through that time, interestingly, who I would interact with were the nurse case managers, because they were doing discharge planning at the bedside. And I was like, it was kind of during the Affordable Care Act was coming out, had just come out. And I was like, these people understand the business at the bedside. They talk to every discipline. They talk to the payers, right, to assure we're getting paid, because they had, at that time, it was utilization review, and case management did the same. That's not really the case anymore at most health systems. But so I got to know that, and I was traveling a lot. I had a newborn, and I was like, I can't do a lot of this anymore. So I actually got a job locally at Virginia Hospital Center as a nurse case manager and loved it. Hard work. Had another baby at the time and was born, knew Inova very well. It was a little bit closer to my home, had on-site daycare. I tell our HR leader that all the time, our people leader. I'm like, the whole reason I came across from the competitors because you're on-site. That was very important to me as a new mom.
Easy.
Yeah.
Yeah.
So did that, somehow got myself into leadership. Long story short, and I tell people this, they're like, how did you make that change? And I'm like, well, for me, my husband, again, small business owner, we were working really hard, both of us. And daycare was expensive. And I was like, well, why don't I'm like, case management is it's all about length of stay management, a lot of it. And I noticed when I'd set everything up for the weekend, that patient 15 patients ready to go on Saturday, and I'd show up on Monday and they were still there. And I'm like, what? I'm like, why don't you let me work every Friday through Monday, and I'll be your weekend person at one of our small hospitals, community hospitals, Fair Oaks, which I went to elementary school, like literally down the street. So I'm very local, which I love that.
Right.
So anyways, I kind of created my own informal leadership role without even knowing it. And from there was an opening at Loudoun Hospital, which was within our system. Went there, became a director, very young leader. I mean, I had like a newborn, not newborn, but he was probably 6 months old at the time. And then a 2-year-old. Worked really hard. Like, I was passionate about it. Then there was like this job opening at Fairfax to be a senior director of case management over like 100 people. And I was like, oh, I don't know. You really want me to do that? Yes, we want you to do that. So here's the funny story. So I get there. That's where I was born. And Ron Ewald, who was the CFO at the time, who's a huge mentor to me, came to see me in my office, which was in the original building.
Yeah.
It's like, welcome. I'm like, I was born here. He's like, oh, what year were you born? And I was like, 1979. And he's like, started laughing. And I'm like, what's so funny? It's like, well, this was labor and delivery where your office is in 1979. So you were like born in your office.
You were always meant to come back here.
Yeah. And I've been there 16 years. And it's an amazing organization. It really is very focused on quality. I think I'm on my 7th job along the way of doing different things.
Okay. So before you came into RevCycle,
Yeah.
what were you doing before that?
Okay. So case management over leadership, over
Yep.
case management, and was within that point, not under RevCycle at that point. Then I went to become the vice president of the Children's Hospital. We were opening a new building at
nice.
Fairfax.
Wow.
And we have one of the busiest neonatology units in the country. It's like 100 beds, very specialized,
Jeez.
and even more specialized now.
Yeah.
Then I was over what was called our towers. So it was like our biggest hospital on the campus. So Department of Medicine, Department of Surgery, the trauma program, respiratory therapy, the GI lab, the endoscopy
I got
suite. You got me. All the
All
stuff.
the-
Med
still the GI lab.
surg, blah, blah, blah. And then right before COVID, we went to a service line model. We become much more systemized, and I got a job as the medicine service line vice president. So that's over everything acute-based medicine for the physician groups and operationally, and our ambulatory practices that were medicine. So here's how I got into RevCycle. I know that I'm being very long-winded right now. So
It's good.
during that time, I was like when a group wanted to be, I was in charge of all of our contracted groups as well, to include emergency medicine, to include GI, which was private practice at the
Yep.
time, pulmonary, and they were all approaching us about employment. And I knew their yield, it was revenue and cost based, is what was going on with them. But looking back, I think their cost to collect was getting higher and higher. And they were having a harder time with payers, to be
Collecting all
honest
the
with
money,
you.
right.
Yes.
Yeah.
And as I was just saying to you earlier, what happened was we have the second or third busiest emergency department in the country at Fairfax Medical Campus, 1,000-bed hospital right near here off 495. And the group went bankrupt. And
Which is insane.
Right.
Yes, yes, national group. And we knew that, and I know a lot of those positions very well. And everybody was nervous about what was going to happen next. They were telling us they were going to get out of it, but it had to do with the No Surprises Act. And they were holding out on contracted rates. And the payers were like, screw you, take it or leave it. And I can tell you my brother's, private practice doc around here too, ER doc, not with that group. But that was what was happening at the time. It was probably like 2022, 2023. I don't even know, 2023-ish. And I started to learn about this, about what was happening.
Yeah.
And I remember talking to our government relations leader, Mike Forehand, great, smart guy. And I'm like, why? I know it sounds great to patients, like no surprise billing, but do people not understand what's happening to providers behind the scenes? He goes, Erin, the bumper sticker is too long. Like, people don't understand. You're never going to be able to explain it to people. And that actually, at the time, we had an interim leader over RevCycle. And I knew a lot of those people because back in the day, I'd sit in all the high dollar meetings because I had UR under me. And they're always talking about the track buckets. And I had to go to a lot of those meetings. And I would ask a lot of questions, but I wasn't really interested in doing that at the time.
Sure.
And I knew the CFO at the time, Alice Pope, very well. And I said, I think I could do RevCycle. Like, I'd gotten to know her. And she's like, first she was like, I don't know. And then she's like,
She
yeah,
said,
you
it's very
actually.
complicated.
She did.
It's true.
She was like, she had a lot of good, she's like,
No, of
yeah,
course.
you could do this. You could do this. And so that process, was long. And August of 2024 is when I started in RevCycle. So
you
it's been
asked
almost
for
2
this.
years.
Yeah, basically.
Yes, I did.
Yeah.
I did. I knew a lot of the leaders within the
Just
system.
want to make sure we're on the same page.
And I was like, what the hell did I get myself into?
Yes.
For sure. Like a
Yes,
little
what
bit of
was your,
buyer's
yeah,
remorse.
what was your first month like? Where you're like, holy shit, like what am I doing?
Well, I got lucky because we had Impact Advisors was a consulting company that
yeah.
our IT leader, Matt Cole, had really, he knew them well. And we had a lot of catch up to do with Epic. And so they kind of brought us back to baseline of using Epic at the, to the best ability we could at where our upgrade was at the time. So I had them with me for a year to help
That's
me
helpful.
really
Yeah.
expedite
Yep.
getting like low hanging fruit
Yep.
stuff done. I mean, my first month was like, I don't understand what the hell you guys are saying, and constantly
Same.
chat GPTing and trying to figure out on the side. And I would ask
the
all sorts of
language.
questions. Yeah, I
It's
was
a-
like, you got to stop with the acronyms.
Yes,
I
it's a
created
foreign
dictionary.
language.
Yes.
I created a dictionary.
Yes, you told me, which
Yeah.
I still want that, by the way.
You can have
Because
it.
I still do it. All the
Right.
time I'm like,
It's
no,
incredible.
tell me what this is.
And I had a couple people like send me, I've started filing, and it's like, I mean, it's huge, and it's
Yeah.
not just acronyms, it's like definitions. But I tell people all the time, like, I'll go to another site and they'll have a word I don't know, and
Yes.
or an acronym, and I'd be like, what do you mean by that?
Yes.
Because I think you've heard it all, and then you're like, you haven't heard.
No.
You've heard a new one every day. I'm like,
People
what?
use words interchangeably all the time, too.
Yeah.
And I learned very quickly, like for me on the operations end, my prior roles, like I was in charge of a budget, but you think you're doing well when you hit your volumes. Because, finance, they're just calculating your revenue based on a blend of what you think you're recovering, and you have no idea what. I was like, holy, what is going on back here, to where the frontline physicians need to know.
It's all
these
volume and
things.
estimate based, right?
Yeah,
It's
I
not
mean,
any of the other.
That's right. It's nothing of the
and
other
the nuance,
things.
the difference in the nuance is like so significant.
Yes.
On $1 billion.
Yes.
Or $10 billion.
Yes.
That
Yes.
you're like, you can't.
Yeah.
This is why I was early on at R1, right? At Creative.
Yeah.
This is what our early model was, just yield based.
So
So just improvement based. But the problem was, there was no doubt we were making improvements. Problem was, you couldn't just be like, the difference between 0.1 and 0.09 is actually a huge amount of money.
totally.
So if you're getting paid on that, it just became an argument, because you're just like, well, we couldn't owe you 45 million,
Well,
Right.
right? And that is also like still the problem with like a yield number today is like, it's actually really nuanced. And a lot of times there's such a lag,
yes.
and when it happens,
Totally
payments,
agree.
there's a long tail that's so long that
I
it's
know.
like hard to even imagine.
That's the hardest thing with revenue cycle. Like you're never really, you can say, yay, we won, but then there's something over
Right.
here like you got to fix. There's always something to fix. I
Something-
tell my team
Post
every
office,
day.
It never stops.
Yeah. I'm like, this is my quote, because I feel like there's so many issues all the time. And I'm like, to quote Jay-Z, we got 99 problems, and this is or is not one today. That's not the real line, but
It's a great
Yeah.
one.
because
Is that
I
on
like
your
have to
wall?
lighten the mood. I have to
know.
lighten the mood most times, because we're like, oh,
Right.
what? We had no idea that
Right.
was happening, right? So, I mean, it's been a journey, I'll tell you. It's changed so much even since I've started 2 years ago. So it's very different. We're doing things differently. We're really redefining processes. I have a technology enablement team that I'm embedding within our team, using a lot of industrial engineers
Nice.
to help
Smart.
us. Yes.
That's great.
Trying to bring new kind of outside thought into rev cycle and promoting from within. I feel like there's a lot of opportunity to pull up,
Yeah.
as jobs change. So,
Yeah, for sure.
so,
Okay, try to finish the sentence. Revenue cycle is to you.
the hardest job I've ever had.
Oh, that's
In
sick.
some ways. Yeah. I mean, maybe not. I think culturally, it's actually revenue cycle teams compared to clinicians are adaptable. I'll tell you, they're a little bit more they're not as comparatively. They're a little bit more trusting of, once you tell me to try something, okay, I'll do it. Well, at least,
Right.
and I think they're easy to engage to some degree. I mean, for my team, they just need, we talked about this before, like they need someone to help tell the story on their behalf, right? Especially when you're in the weeds of this every day. You don't have great data. Anecdotally what's happening to you, but you can't articulate that well, especially the rest of the organization. And I'll tell you, when you're sitting on the other side of the organization and something's off when with your net revenue, and it's not your payer mix and it's not your service mix, it's easy to go, what are you guys doing back there? Why are you not collecting? Right?
Revenue cycle is terrible. Like they don't know what they're doing.
Yes, that's easy to happen.
Because it's a black box. It feels like it.
Totally a black box, and there's so many different specialized roles within. And that is a little bit what I found when I got there. It was very siloed, divided. We're doing our job every day type thing. So that was one of our big things we did, was try to integrate the front to back to middle. We created a denials prevention team within our revenue integrity team in the middle, which is good because I felt like the back end was getting screwed. Like they were just picking up the pieces for everything.
Always, but that's,
right?
that's the
right?
role.
Right.
But
And
yes.
nobody understands what's going on with the denials and managing the denials. There's 1,000 work queues literally out there. And, so I had to figure that out. I was like, you guys can't be reporting out to the rest of the organization and trying to tell the story and manage everything you have in front of you every day. That's not working. So we changed that up a lot.
So do you do that now then? You manage like the storytelling? You're talking to the organization. It must be easier having
Yes.
some street cred
Yes.
because you have
Yes.
credibility.
I have a lot of relationships. That's why I've never left Inova, because I feel like it's,
I know Bob, he can shut up.
well, that is a
Shut
little,
up.
as I've had different opportunities, I'm like, I'm going to have to rebuild all these relationships. It's going to be harder to get things done, quite frankly. Don't get me wrong, I tell the story, and sometimes the story is not pretty upon what's going on the front end, right? And we need to fix. And that's what I feel like is so eye-opening. And I feel like it's going to be more front-facing as the technology gets better, as we're able to identify patterns within payers and, get better at understanding how the policies, when a physician's ordering something, what will they see in front of them, that the policy requires this, that, and this.
Right.
I think that will create different problems, right, of provider burden,
Right.
quite frankly.
Right.
But it will, it will help us get paid accurately, help with preventing revenue leakage. So there's so many problems to tackle. I've listened to your podcast talk about the payer
She's listened.
provider relationship
Oh.
is really difficult. I find sitting on the JOC calls at points, I'm like, why can nobody on your side turn on your camera? Like, why can you
Oh.
not turn on your camera? No,
Oh, they won't even turn on the
like
cameras.
10% of payer liaisons or people on those calls turn on their camera. I don't know what it is at payers. They just don't.
Wow.
We in my time we had to meet in person, so I was like, you
Oh.
better show up.
And that's what the people within my team that have been doing this for a while, they're like, it was so much better when we would meet in person.
So much better.
Yeah.
Yeah, because now they can hide from you.
Yes, that's right. That's right. And they can, we'll get back to you on that.
Right. They can push you off
Yeah.
and evade and
Yeah.
send you a vague email
Yep.
and an out of office or,
Yep.
or I'm in a meeting or,
Yeah.
What we always had was like, typically we'd had like good meetings. It'd be like, okay, yeah, we're gonna work on this. We're gonna take these back. We're gonna fix this. And then we'd be working on these longer term strategies. And what would happen is it'd be like, yeah, okay, this is great. We love this idea. And then they'd go, and then we meet again and be like, oh yeah, what were we doing?
Yeah.
We ran into this problem. Like, we're gonna act it. And then it'd be like 6 months. And I'd be like, we haven't gotten anywhere on any
Yes.
of these things, because every time they come back to be like, well, this happened. And then what would they do? They would switch out the rep.
Yes.
And so then we have a new rep. And like,
Totally.
oh, what was Bob doing? And
Yes.
you're like, what do you mean, what was
Right.
Bob doing? We were just
Right.
working on these things. And that would be every time. Every payer. Didn't matter who it was.
All right. So I'll tell you some positivity. I'm seeing that shift a little bit.
Really.
Elevance.
I'm skeptical.
I'll call them out positively. Their national Elevance approached us because our CIO has a good relationship with their CIO.
Okay.
And I think they have a new CEO at the top. And he was like, I'm giving you guys an order and I want fast results. Start going out there and make it a little bit easier to work with us and figure out what the providers want. So, I'll just say we had a breakthrough last week. And we've been working with them on CARC and RARC code matching and trying to figure out, like, what does it mean? What does this mean? What does that mean? Should we direct API? How can you guys use Epic Payer Platform better to at least exchange records, right?
Sure.
Which some of them are doing that.
Okay.
Some, I know. I can tell you stories of where we're calling them out.
They're taking too much information, or I don't know.
Well-
We're not using it right.
If you can just come on, don't have me fax or mail you the record. That's ridiculous, right? We got a law passed in Virginia starting the beginning of this year that they can't do that anymore. when they're requesting records because of PHI. Because I was like, what do you mean Ben's record is sitting on the side of 66? You don't know where it is. When I mailed it to you 5 weeks ago.
Crazy.
Where is it if you don't know where it is?
Right.
Anyways.
It's on that curly fax machine that rolled under the table.
No, mail. They want you to mail
a physical
boxes of record. Well, all of the payer integrity vendors, you know, they all pull those games still. Oh, well, you have to. We don't have access to that, so you got to mail it to us, right? Anyways, but here's the breakthrough that we had last week. So we've been meeting with them a lot, trying to figure out what we can do better. And this is, mind you, different people we work with for Anthem for Virginia.
Sure.
So we figure out the Kark and Rark code that we have coming to us, which we thought it was like the last Kark and Rark description, and I'll get this wrong, Olin will kill me, our COB leader, but he was so excited. He's like, Erin, we have thousands of Kark and Rark codes coming back with missing record or missing, like you haven't sent us something yet. And we thought it was falling to our follow-up team to call, and calling is the worst, we all know, to figure out. And it's like many times the blind talking to the blind, like they don't know, they get different answers all
There's
the
like a general
time.
code doesn't tell you what you're missing.
Exactly.
Yes.
So come to find out, there were several Kark and Rarks that were coming before that many times it was like an authorization denial ahead that we should have been working at. The point is, we should have been working it completely differently. And I feel like payers have been very reluctant, or they don't even, people you're talking to on the phone, they don't even understand why. Many of them are like, I don't even know what a Kark and Rark is. Why are you asking me for that? Right? And I'm like, what do you mean you don't know what this is? Like, this is how we do this is how we get information back to know what you want, right? To get this paid. Like, what do you mean? But I find my biggest problem with this whole dynamic is I feel like payers they're incentivized financially to be operationally inefficient on their end.
Yes.
Right?
They're
and
a
I
bank.
feel like, I know,
They're a bank.
talk about feelings. It's a little infuriating. And I understand
We've
their
had a
business
breakthrough
model.
with Erin.
A
Talk about
breakthrough.
your
Yes.
feelings.
Yes. You
But
should.
Yes.
But the problem is you're having success here because those people you're working with are one team.
Sure.
That they actually are trying to get things straight.
They're the IT people.
Right.
Right.
But they silo things on purpose.
Yes.
So
I'm
they're
not-
siloing things on purpose so that those people don't talk to the contracting people. So that would be a totally different group that doesn't have anything to do with these.
I know.
And these guys are like, they want us to do what? In what
Yes.
contract? Oh, the system doesn't work that way. And by the way, they bought 3 other plans that don't actually merge in. So this is the ultimate problem that we're up against and these large, and United is worst.
Yeah.
Because they actually are organized, and they organize themselves, and they split it up so that my region, my person who's really nice, because we used to have them come to our forum, and I finally was like, this is ridiculous.
Right.
You're the nicest person, and he wants to do something. He can't do anything outside his region.
It seems
So you can't actually get anything done to the rest of the people. They're like, oh, well, that Dusty's nice, but we can't do anything. I'm like, don't bother coming.
Well, to your point, it's like I like to solve problems with what I can control. So you can't control that, right? What can you do that you can control? And that's where you can embed technology to get better at the denials game, prevent them, work them faster.
Right.
And I do feel like payers are catching on to that. Our denial rate is good now, comparatively. I mean, call 10% good, but apparently that's good.
It'll go
nowadays.
back up, though.
I know.
They'll change
because
what?
they're
They're gonna
something
change.
I totally
Right.
agree.
They're gonna get their
Policies
numbers.
are constantly changing. You have to keep up. It seems the retraction game is a little bit more challenging, quite frankly, and I feel like that's where they're going. Maybe that's a different revenue stream too, for their,
Well, here's we want to know a little trick.
Yeah.
Because I've been diving into this whole other world, which is the employers. You probably heard me talk about it.
Yes.
Employers and the insurance company being this kind of intermediary.
Yes.
With the drawback of medical loss ratio and standardizing it, everyone thought oh, this is a good thing.
Mm-hmm.
It was actually the worst thing we could have done because what happens is they can't cut costs. All they can do is raise their rates. So they actually want to pay you more a little bit because they're going to look like they have to then to the employer be like, I don't know, our claims are really high. And they're not giving information back to the employer. So then what they can do later is take it back,
Yeah.
which doesn't count towards the total.
So I've sensed this.
So that doesn't count towards the total. So now they can be like, oh, our costs went up 6%. So we're going to have to raise our premiums to the employer higher. I'm telling you, like, this is all a game to
And
be
who
like, how do we get
this? This is so
because there's too
complex.
many intermediaries. There's too many parties
I
that
know.
want to like, and this did not exist. My whole point is I went back in time. You probably haven't heard this talk.
No,
I
don't
did a
think I
whole
have.
talk on the history of insurance.
It's really
Okay,
good. It's
okay.
really interesting.
Because I started to do some research about, it all started with I wanted to know, why is it we're collecting balances from patients? Like,
Uh-huh.
how the hell did we get
I
responsible?
Why
totally
is it
agree with that.
Right? So like, how did it
That's a
become our
nightmare.
responsibility? We didn't decide it.
And patients just are mad at us.
But that started, and then I got into this rabbit hole of like, how did we get insurance? And everyone thinks they understand it, and they don't understand it. But my point is like, insurance didn't exist,
Mhm.
and we were providing care for people. Now United is the largest healthcare company in the world of any type, not providing care.
Right.
And it is widely regarded that health insurance is taking up 30 to 40% of the cost, of the total cost of providing health care. It's just an intermediary. It doesn't actually provide anything. And back in the day, what's crazy is Blue Cross got formed by the American Hospital Association. Most people don't realize that. And Blue Cross gets formed, and Blue Cross is like, well, we're not a typical insurance company. So they argued back in the day that the hospital was actually the reserve, that they didn't need to carry reserve because they were the risk.
I've heard you say that.
They carried the reserve because they provided the care. So they don't need to have money in reserves, which is insane, right? Like, you're like, oh my God, we're the
Erin's
ones
feeling
carrying
her
the
feelings
risk.
again,
Let me go.
everyone.
I'm just going to go back to my last roles before Rev Cycle. I think what really pisses me off, I see, I get emotional thinking about it. Like clinicians at the bedside, like they just
They're
care
trying
about,
to do it.
Yes.
Right.
Yes.
They're trying to do the job
They're payer agnostic. They don't want to know when insurance
Agreed.
that they're going to take the best job they're going to do the best job they can with the resources they
Yes.
have. And we do, I feel like at Inova, a really good job at providing whatever they need at the bedside. Of course, we're, thoughtful
Yes.
about that assessment, but I don't know. It bothers me that this whole piece, we've talked about for years. You got to be Medicare break even. You got to get your costs down. You got to, length of stay management and understanding all of these things. What are you doing that's unnecessary? Of course, we're thoughtful about that. Of course, we're thoughtful about readmissions, right?
Yes.
There's a lot of uncontrollables out there. And let me tell you, healthcare is getting harder at the bedside, right? The patients are getting sicker. There's a lot of workplace violence at the
Yeah.
bedside that people don't
it's-
talk about.
Yes, legit.
There's a lot of provider burnout. And I don't know. It's just seeing this side of it, which you can get. What I don't like is I don't go to the hospitals as much as I need to be doing that more, because certainly I have people at the bedside too and our patient access and medical records. But it's a different dynamic, right? You can easily not see that on this side of it too, right? You can get lost in all that. So I don't know.
I think what happens is like outside people try to like make it make it almost like, oh, it's just, hospitals are the problem.
Yeah.
Yeah, we're not. They're not. There's issues on the
Right,
hospital side
sure,
for sure.
sure.
Like, physicians are the problem. It's like, no, it's a really complicated system.
Yeah.
We have created it. We have created the system,
Yes.
and I think that it is gonna require a bunch of people to like do things that are different.
Do you really
Out
think
of
it's
the
going
norm.
to change?
I think. Well, I think employers are the only ones who can actually.
Right. I've heard you say that.
Government's not going to do it.
Because they
Yeah,
have
I
the
know.
mon-
I don't
they
think
have
the
mon-
government's going to do
right?
it either.
Because the money, it's capitalism.
They're
The
paying the money.
They're paying the money.
Right.
Like that's follow the money. you know?
CMS cares about. Did a stint, like a talk trying to talk to the CMS administrators about a couple months ago, and understanding what they're talking about. It seems that they care about access for sure, right? And they want this free market idea, talking about Medicare Advantage and such. And their advice is, honestly, when you bring up anything that the payers are doing, this whole Aetna level of care, get rid of who cares about the 2 midnight rule? We'll decide, right? We'll say it's inpatient, we'll prove it, and then on the backhand, we won't even send you a denial, but we'll pay you what we think you
Hidden
need to be
denials.
owed.
Yeah.
Right.
Terms of observation.
That's been it's and the advice CMS will get you is, well, then go out of network, right? Which is easy. It's not as easy as you'd think to do that. You can do that. First of all, that's a big community hit. You have to think about that and the patients that have that insurance. It's not easy for them just to switch mid-year, but that's what they'll say. But they do care about access, it seems, and they want new market entrants, it seems, for managing Medicare, et cetera. But I don't see that going away, at least not in this administration, with the with the Medicare Advantage piece.
No,
I don't know. My point is,
that's its own problem.
yeah, it is.
I kind of leave the government out of it, to be honest, because I think it's going to do its thing. And
Yeah.
It's going to change.
Yeah.
Of course, that's going to happen. I think that they're going to figure out some system that's going to work.
Right.
I don't believe that, but employers do have the capability. And this is a crazy stat: is that 80+% of large employers, 100 or more people. So that's a considered a large employer. They're self-insured.
Yes. Oh, yes.
So they're
I'm following
paying it
that.
out of
Sure.
pocket.
Absolutely.
And that number went from $5,000 in '94
To 20.
$25,000.
Yep.
That's adjusted for inflation.
Right.
So today it's $25,000 an employee, and it's an employee benefit, just like a 401k is.
Yep.
So most employees don't think about the fact that, like, actually I could have $25,000 more dollars,
Yep.
and I could decide what to do with that.
Or if you put the $25,000.
That's where it gets. ERISA was actually created because it was trying to protect the 401k, because that's how it all happened. But they lumped in this. But today, that's worth way more than your 401k match or whatever it is.
Right.
So that's what's happened. Class action lawsuits are starting to happen. And this is where the fiduciary responsibility comes in.
Yes. I've heard you. Yeah.
So fiduciary responsibility is the big thing, and it has not changed that the employer is still, even if they're going through insurance and farming it out to the insurer, right?
Yeah.
Who you think is doing all the work and actually should be, courts will not find them to be the fiduciary responsible party. It's the employer. And that is a very, very interesting.
Let me ask. Can I?
Okay.
I have a question.
No, go ahead.
So why couldn't an employer just put that money into a health savings account?
Well, that was what I would
that
say.
would have interest,
Right.
and then you could spend that money on healthcare as insurance. Like, why is that
Well-
not a possibility, or is it a possibility and just no one's doing?
Okay.
I would change insurance altogether, but
Well,
Would
I know
you?
that.
I wonder with newer generations and newer ways, and this is actually scary to me to think, will employers stop giving traditional insurance, which would be a big problem for us because it's like a very, very, very low percentage of our net revenue that's, that we collect from patients and high from insurance. Like, will insurance change completely? And the cost of care is not, the cost curve is very difficult to get down from our end. Our margins are not huge either.
yes,
And
because you're a giant
Right,
system that's
right.
built to cover really emergent things
that's
and
correct.
big things.
We do
all comes
almost
at a cost.
everything. Yep.
My thing is that insurance could not solve and still has not solved the problem they identified in the 20s, is that it cannot do both of, like, incident where I have an event and something happens to me. That's easy to cover.
Yeah.
My auto insurance covers that way. My home
Yeah,
insurance covers
yeah.
that way. And maintenance. And
Right.
maintenance is a wholly different thing.
Right.
So we're
Right.
lumping it together, and now we're expecting it to cover everything.
That's right.
And that's ultimately what insurance can't do both. Otherwise,
Yes.
it becomes so expensive. So I actually think what employers should do is they should direct contract with a hospital for everything event-based.
Uh-huh.
Have a reinsure that handles catastrophic claims, right? So if it comes too high, then, like,
I see.
something kicks in, right? And then they start creating a network, maybe through a hospital, but also maybe buying a clinic. So I know employers that are buying clinics. They're just like, everyone's going to go to the clinic for free. It's unlimited amount. And there's this virtual option, unlimited amount. because then you start managing that piece, and there's no deductibles. So you just work through.
Right.
So what do you think is preventing that from happening?
They don't. Problem is, it usually lives in HR, and they think about it twice a year, once
Yeah,
a year.
I think that's
So
a
at my
fair
last
point.
forum, we had Jason come, and he's a broker for employers.
Uh-huh.
And he's like, I'm telling you, he's like, once a year they think about it. And it's an HR person. He's like, they don't
know.
They don't know. And the CEO's just like, I just want people to have health care.
You know what's interesting too?
And don't change the insurance, because that pisses people off.
That's true. It does piss people
I
off.
know, but like, I'm like, at $25,000, that's their number one line. Starbucks spends more on health insurance than they do on beans.
And what was it a statistic too that patients, I read this, or maybe I heard it on your podcast, I don't know, that like
Oh,
Source of
most
information.
people, their premiums are higher than their mortgage. And they don't realize it because it gets deducted right before your paycheck, but they're not. It's becoming more and more expensive. That I think our family deductible is like $8,000. We haven't even hit where we're using it yet. Thank goodness we have I'm putting into the health savings plan, et cetera.
So you're paying for your maintenance.
Yeah.
Basically.
But it's very interesting. But to your point, I think I know a lot of big employers around this area, they're skeptical to change that benefit because, we're in a competitive market, a lot of contracted government employees, right? And they don't want to lose that talent. So they're keeping it the way it is,
of course.
right?
But the alternative is like, we got to cut more people and AI has to take all their jobs. Like,
Right.
That's actually
So would
the
you
crux.
rather have a job and have different insurance or no
So
job?
I mean, that's a
gonna be
different
interesting.
dynamic,
So I
isn't
don't
it?
know what happens. I don't know how it. I just know that like if there's a group that has the ability to go do it, it's them, and they have the incentive.
Yeah.
You have the incentive.
I don't know. I wonder. Yeah, why? I don't know.
We've
I
made
don't know.
Erin speechless. I don't know that we've helped her with your feelings.
No,
we got some
I don't
out.
think
I
we've
think we've
helped her.
made some new ones.
We haven't helped, but it was good to talk.
Yeah, this was fun.
It's
Thank you.
fun.
I wasn't
come
sure what
back
this was going to be
again.
like, so
It's
kind of
just
cool.
a conversation.
Wait, did it exceed your expectations, or was it below? Like,
No,
what
for
was it?
sure.
Or-
I mean, no, it was good. It was good to get to know both of you and
We hope
hear
you'll
what you
come
have to
back.
say, like front and center. I've heard you, and I'm like, oh, that's an interesting thought. The fiduciary responsibility has really got me thinking of that piece. I wonder if the class action suits, because the employees really understand all this stuff. The lawyers do, but
They haven't won a case yet.
okay.
The only case that the courts is a whole case that I've talked a lot about is this Tierra Yachts case in Michigan.
I have to read that book. Yes.
Oh, but that case is we could talk on the whole podcast on just the
Okay.
case because it's incredible.
Interesting.
It's incredible what they were doing. Like totally illegal. 100%. Like should not. People should go to. They should be in prison. It's like white collar crime is what it should be. So it's crazy. It's insane. Stealing money.
Well, that's
Erin will read the
disappointing.
book and she'll come back.
Yeah, that healthcare. What is it? The American healthcare heist.
Oh, yeah.
Yeah,
Yes.
Christy Ken.
Yes, you
I
had
don't
her
know-
on your
well,
podcast.
part of it's in there, but they just had more with this Tierra Yachts
Okay,
case. But she's
okay.
done a bunch of research and published on it. But
She seems very smart.
She's great.
Well, thank you.
Okay, thanks, Erin, so
Thank
much.
you. It was
Appreciate
fun.
it.
Thanks for coming.
Awesome.